And when we're putting together an intervention, we have to look at what's clinically necessary. We look at the workflow of the doctor. And we have some examples where we're doing medical home and chronic disease care, say diabetes and mental health. And for that, we need a portfolio of tools to work on. It's no one thing. It's hard to come up with order sets across the country and just hand them out. There are some things that are standard procedures that we can put in order sets. I'm finding that a lot of it is done at the local level, that you have to see what things you're working on. And maybe as we go forward and care gets more standardized, we can share order sets more easily. But for this initiative, for example, where we're looking at the interaction between two complicated things, a chronic disease and mental health, the order set for the intersection of those two things doesn't look like either of those alone. So I can't just borrow a chronic disease order set or a mental health order set and expect either one to work. I need one that's designed for both. If you look at some of these complex projects, like the example I gave of chronic disease management with mental health, it's every aspect of the electronic health record is part of the decision support. So it's no longer that decision support is the alerting system or the order set. It's the entire environment. And we found, for example, that some alerts are being overridden and other are being overridden, but if we place it in the right place in the clinician's workflow, it'll only get overridden a minority of the time. So it's the human factors part, understanding the human factors to put together the different pieces of the EHR into a system that really steers healthcare in the right direction. I think we're missing something. We know there are pieces that we've had alerting systems since the 70s, documentation systems for a couple decades, order sets for 3 decades also. Is there some other model of looking at this that puts these pieces together in a way that's a little more rational and makes it easier to manage the thing, create the knowledge that you need in the system? And then the other direction, of course, is using our experience to inform the future. That is, seeing how patients respond to treatments and then incorporating that into our new knowledge.